good that he has got gloves on this time at least. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today I am going to be doing another instalment of Real Dental Nurse Reacts 2, and this is a few more episodes of my family. So I loved filming this last time. Again, it's like the only thing I can think of with dental scenes in, but if you guys have any ideas of what I could do, please let me know and I will try and do them for you. I managed to find every episode on BBC iPlayer. So it's probably going to be a bit better quality than the last video. I'm going to do probably 2 episodes again because they're not whole dental programs. They've only got small dental scenes in. So we're probably going to do either 2 or 3 episodes in one video. Also, just very quickly before we start, I'm probably going to be dropping my schedule to 2 uploads a week instead of 3 because I've just started a new job. I'm still dental nursing, but I can't work at the minute because obviously the world is like shut down. So I'm doing a new job, a work from home job, which means it's not giving me as much time as what I did have. Obviously, because I can't work as a dental nurse, I'm not earning money at the minute. I need some money, so I got a job. So the uploads are probably going to go down to 2 a week instead of 3. I don't know if I'll be able to do 2 a week when I go back to it. I don't know, we'll just cross that bridge when we come to it. Anyway, if you would like to see me reacting to these scenes, then just keep watching. Okay, let's get crack-a-lackin'.
Hi.
Hi.
So you're not angry with me?
No, I'm not angry with you.
Oh, forgot to say, this is season 5. I just wanted to see how much had changed from the first series. Obviously, we picked up that he wasn't wearing gloves for some of the patients. So I decided to skip ahead a few series to see what had changed, because obviously dentistry is an ever-changing industry. I mean, not really for PPE, but I just wanted to see what changed. So I'm going to be skipping to the dental scenes specifically in this. Just wanted to get that out of the way. Have I picked the only blooming episode without a dental surgery in? Ah.
That is me, Nick.
Hello. So funny.
I am Ramon Manukas.
Merciful heavens.
I am born in Portobanos and educated in Madrid. I am looking very much forward to working here in England.
Yeah, I'm looking very much forward to booting you up the backside.
Okay, kind of obvious first of all, somebody should not be coming into the surgery while there's a patient in the chair. Obviously, it's a bit different for staff, you know, if a nurse needs to borrow something or whatever it is, but especially the dentist's son shouldn't really be coming into surgery. Second point, dentist isn't wearing his mask, he's just got it around his neck, so that should be up. But it's good that he has got gloves on this time at least. And also, I've just noticed in the background, there is some stab lock pins, it looks like. Probably doesn't mean anything to anybody training if you don't know what they are. But I think it's quite cool that we use the same brand as they do. Yeah.
Nick, please.
Who is Nick?
Drop the accent, all right? I know it's you.
It's the moustache, isn't it?
Thank you.
Wait, yes.
Okay, that wasn't a very long dental scene. So we're probably going to have to do quite a few episodes of these. But yeah, it all looked good from that point. So let's see if we can find any more.
Teach me how to tango, yeah?
The Tango Argentino.
Yeah.
And so,
Yeah.
yeah, head. So,
Please.
don't fight it. And forward, 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 side, stop. Forward, 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 stop. And up.
Just going off of that, the only thing that I noticed, and if I go back a little bit, so Roger, which is the other man, is wearing scrubs. Ben is just wearing a normal t-shirt and trousers. Why? I don't know. Ben should be wearing scrubs because it's not great to just be wearing a normal t-shirt and trousers because that's not clinical wear. He could have just come into work wearing those, and obviously, as we talked about in the last video, you're not supposed to be wearing your own clothes. Yeah, you're not supposed to be wearing your own clothes in surgery, but you shouldn't be wearing clinical wear outside of the dental surgery either. That's something to pick up on. Ben isn't actually wearing clinical scrubs while he's doing dentistry. Don't know why I didn't pick that up in the last episode. I think it's probably because Roger's now there and it's kind of clicked. Anyway, should we find another scene? We'll go for it and see what happens.
Sorry, Ben.
I forgot something.
Oh, that was it. Can I also just say, I know we haven't really seen this, I can't remember her name, the blonde haired girl's face. I didn't think it was Phoebe from Friends, but I always thought of her as Phoebe from Friends because maybe the hair's the same and their character is slightly similar. I always thought they were like the same, not the same person. I don't know how to explain it, but I always thought of, oh, what is her name? I'm gonna have to Google it now. Abby. Always thought of Abby and Phoebe as like kind of the same. I don't know. Did anybody else think that? Or am I just weird? I'm probably just weird. So that wasn't really a dental scene we just saw. I guess it was like a children's day, and some dental practices do have these days, probably in the summer holidays, so they can set stuff up if they've got like a little garden in the surgery. And they just make the surgery really nice for children because it's a scary environment for children to go into. It's very clinical. I hated the dentist when I was a kid, absolutely hated it. And even though all the staff are really friendly and you try and keep them calm as much as possible, the surroundings aren't childish surroundings. Of course they're going to be scared, they're going to be nervous. You just try and make the surgery as child friendly as possible. Lots of colours, you know, big words. We don't personally do this in my surgery, but some surgeries do Children's Day. It's a day set out specifically for children. It's a bit stressful because it's 5-minute checkups back to back, but it's for the children just to give them a bit of a better experience. Okay, so nothing really too wrong with that episode. We can tell there's been some major improvement from the first video that I did. The main thing was the scrubs, and I did also notice the watch on Ben again. But apart from that, all look pretty good to me. So this is still series 5. The thumbnail was a dental scene. So I'm hoping that there's going to be a couple of dental scenes in this one which we can analyse.
Well, it's very romantic of you to take me out to dinner.
I know. Hey, don't ever say I don't try and put a little spark into our marriage.
Always forget I need to skip to the dental bits. I get so engrossed in this programme. Right. That was it. Obviously not very professional to be playing darts while you have a patient in the room. The fact that there was 2 dentists in the room, unless one of them needed to ask the other something about specifically dentistry or a patient, there's probably no need for a dentist to go into another dentist's room. I mean, that was obviously a tiny clipping, but that's what I'd have to say about that. Don't even know if there'll be other dental scenes. Ah, here we go. I might as well just keep playing. So just noticing again, mask around the neck, not above the face. Also, he is touching Roger. Sounds a bit dodgy. He's touching Roger's skin with a dirty glove on. Cross-contamination majorly, unhygienic, not safe. You shouldn't be touching somebody else's skin with a dirty glove on because you have to assume obviously their skin is clean. So bit of a red flag there. He should have really taken his glove off to do that, but I get that it's all like for comedic effect and things like that, so I'm not going to dwell on it too much.
Out. Oh, yeah. Oh, yeah. Yeah, that's the stuff. Yeah.
Oh, I've just noticed actually, the bib that the patient was wearing wasn't a disposable material. It's like actual material. It's not sanitary because you'd have to wash it after every single patient. That doesn't really work. So the bibs that you would actually use in a surgery would be disposable one-time bibs only. You'd never reuse the same bib for a different patient. There could be saliva on it, there could be blood on it, there could be like filling fragments on it, anything. So not great to have a bib that's made of fabric or material. Always use disposable bibs.
Yeah, heard you now. Heard you now.
That's probably all that there is in this episode. Yep, that's it. I probably won't do another episode in this particular video. What I have noticed though is that there's hardly been any dental scenes in either of these episodes. One sec, I'm going to switch back to the middle of the screen so that you can see me properly. So like I was saying, there was hardly any dental scenes in either of those episodes. So I don't know whether the earlier series have a lot more dental scenes in. So in the next installment that I do of this, I'll make sure that I go back to either series 1 or 2 so we can really analyse the dental scenes. I feel like also the surgery definitely had a revamp, let's just say that much. There was no nurse in the room. Don't know why, I did see it, but I just didn't pick up on it. Bit of a red flag there. Because the reason a nurse is needed, well, obviously to do the stuff that we do anyway, so doing the notes, doing the mixing of things, the suction, but if anything was to happen in the surgery, you've only got two sides. Obviously there's two sides to every story, but say for example the patient wanted to put in a complaint about the dentist, then you'd have the dentist side and the patient side, and it kind of would be a toss-up as of, well, who to believe, because, you know, the dentist could have absolutely violated protocol, but the patient could just be saying that to get money. I doubt patients would say that, but that's kind of also another reason why you need a nurse, because you need that third opinion. If the patient, God forbid, tried to sue the surgery and was going kind of along the lines of neglect or inappropriateness in the surgery, if you kind of get where I'm going with that, the nurse would need to be in there. You know, a dentist isn't going to try something like that with a nurse in the room. You need the nurse in there as that third person. If the patient tried to sue for that reason when actually it was just a complete lie and total rubbish, the nurse would be the person to say, I was in the surgery at that time, that absolutely did not happen. If you don't have the nurse in the room and a patient tries to say that when it's not true, people are probably going to believe the patient over the dentist, because there is no witness in there, and a patient is coming out with these claims and the dentist is saying, well, that didn't happen. You can't prove that it didn't happen. Whereas if you've got another person in the room, you've got then two witnesses. That was kind of deep. I'm sorry about that. That was a bit on the more adult side. But, you know, that's a major reason why you need a nurse in the room as well. The dentist should never be left alone with the patient. The nurse should never be left alone with the patient. Sometimes it has to happen. You know, if the dentist needs something that is not in the surgery at that time, and that could be because there was an emergency patient in and you don't have this specific thing in surgery because there's just one for the whole practice, say, and the nurse would have to go and get it, then yeah, the nurse does need to leave the dentist on his own, but it's not going to be for an extended amount of time. It's going to be very quick, go get it, come straight back. Sometimes it does happen, but we try and limit that as much as we possibly can and make sure we're always prepared for what's about to come into the surgery. Or, you know, processing an x-ray. The nurse is going to have to leave the room to go and process that x-ray. So things like that do happen, but we try and limit the dentists being on their own as much as possible. So if you want to see more of these, then please let me know and I'll make sure to do them. Anyway, if you enjoyed this video today, please give it a big thumbs up, click that subscribe button down below, and then click the little bell next to it, and that will notify you when I next upload. And I will see you guys in my next video. Bye!